Me toca a mí.
I have the hard task in 10 minutes due to lack of time left. We only have 10 minutes for this debate, for the questions and the debate. And I'm also going to apologize because I'm going to, well, Professor Requena said how impossible it was to define in such a little time all the issues in the church. And the questions of Professor in the lectures by Professor Amado and Requena, it's impossible to make just a flash of all the. We just have 10 minutes, and I think it could be better to ask two questions. One for Professor Granados, that is the following one: how to make the young people see the beauty of relation between the male and the female in the couple, in which in this world when everything that is masculine is toxic. Well, there is very little time to answer this question probably as well. What I have tried in my presentation, and I think this can be one way of defining this, is to focusing this question from the hope point of view, the point of view of hope. Normally we say it is better to say yes than to say no, to say the horizon that sexuality opens, that not the rules, because behind a no there is a big yes, but the hope is not left at the yes, but in the more. It tells us here there's not only the statement of something, but a future is opening. The path of showing the man and woman that in the difference there is a future. There is something that goes beyond not each of them, but the couple. With the question, we could say that in the woman, there is a more in the body of the woman. The masculine is not toxic. It also indicates a more in a different way. We can see it in the education of the child, needs the support of the mother, but the father that is distant opens the way. The father represents an origin to the woman, an origin that life doesn't come from her. And in that way, it can also be presented as the promotion of a more between both of them. One could give to the young ones that have a grandiose horizon and a life that opens up to a project.
Yes.
And the next question for Dr. Arrastua was that in the first session, somebody suggested how there is a change. Well, rather that the son appears as an object of desire, and that's when fertility problems grow. So the question is, if in the program you've done,
Aquellas parejas que queriendo tener hijos,
you do with those couples that want to have children, they don't come along, how can you help too, also from the point of view of the doctor and the gynecologist? So how can you help those people and those couples that even though they do as much as they possibly can, they do not conceive, they do not have a baby? Well, we have Friday. On Friday we can discuss that. But very briefly, and this is, I don't want to deliver a spoiler, but this is just some advanced information, what I'm going to be talking about. But the good thing about natural methods is that they are diagnostic techniques. So in other words, they provide you with information. And the doctor that knows how to read that information can also read that information to see if there's something wrong. So it's a method that allows you to approach a diagnosis of some kind of pathology that is producing that infertility. And when you see that there are alterations in the cycle, you could then, well, suspect that a treatment is required. And there's also an interesting element from the point of view of monitoring the treatment. When you treat the patient, for a case of anovulation or some other problem, you can follow the fertility register according to the information that is reaching you. Because, of course, you give information to the couple, of course, but it's also the doctor that understands the physiology of the fertility register and knows what's going on, and can also monitor the ovarian cycle of the woman. It's like opening a window and seeing what's going on. So that's the first aid. That's the first significant aid. And I'll talk about that in detail on Friday. And then the second thing that is interesting is that, in a way, and when one teaches this way of understanding sexuality and the way they can understand their relationship as a couple, it also means that they can go into much greater depth in terms of the fertility they have as a couple. And they can also, let's say, choose the right space for the child. And what I can see in clinical practice, well, this was mentioned by one of the previous speakers, and that is that people want to control their fertility and they want to control when they are going to have a child. So we're used to controlling everything. We live in a control culture. We control the seasons, we control everything, and we control distances with speed. And we also want to control fertility and decide when we want to have a baby, when we do and when we don't. So this is a very complex business because it's a cultural issue. So a couple comes along, they want to have a child, and they feel lots of social pressure. They have the obligation of solving this issue as quickly as possible and of focusing all of their life as a couple on that target, on having a baby, and losing from sight the issue that has to do with the relationship in the couple. I can assist them from a clinical and gynecological point of view, but I have to help patients so that they don't lose sight of the fact that here we're talking about a vehicle of donation. So we obviously have to try to solve the biological problem first, but there are certain limits. And we also have to recover, well, the fact that a couple has the fertility element as a principle of it. We have the technical side of things on the one hand, and then we have this other dimension that I think is anthropological, which is also interesting, and I think that should be explained to new doctors or new generations of doctors, because one has to accept too that there are certain limits to what one does. And well, this was mentioned in the previous session too. One helps as a doctor so that the body is healed. So you mustn't lose that from sight either in the field of fertility. Well, thank you very much. And well, we also control time in this control society. We're now going to finish on time, and that's how we can recover the time that we've lost. Thank you all very much indeed.